Data menunjukkan bahawa banyak hubung kait antara perubahan iklim dan juga faktor dan juga masalah kesihatan, dan ini sudah pasti ramai yang sudah mengetahui apabila banjir, masalah itu akan datang sekali dengan penyakit dan sebagainya, dan itu bertambah kritikal dari sehari ke sehari. Saya besar hati di COP28 ini saya akan bersama dengan ketua untuk kesihatan dan juga penjagaan kesihatan daripada Forum Ekonomi Dunia, World Economic Forum. Thanks for being with us, Mr. Shyam Bishen. Thank you very much. Today at COP28 we announced or declared 3rd of December as a Health Day. Ironically, it is for the first time for COP28, even though the data released that there's always a connection between the climate change and healthcare issue. How perhaps you can give the overview for the discussion on health at the COP28?
Absolutely. Thank you. Thanks for having me here. Yes, I mean, it's late to declare a health day here. It took us 28 COPs to get to this stage, but I'm really happy. It's better late than never.
Yeah.
I'm really happy that today is the health day here, because as you can imagine, these health impacts of climate change are huge. We are seeing 9 million deaths from air pollution by itself. So that's the biggest killer of human beings now. If you look at the overall burden of diseases, overall deaths per annum, 9 million just from air pollution, because of the respiratory, COPD, asthma diseases, because of the, stroke and cardiovascular diseases from airborne particles. This is huge. We also see that morbidity, mortality from the extreme weather events, that because of the climate change, whether it's drought, it's a flood, or it's tropical storms, fires, that's going to cause about 14 million deaths between now and 2050. So that is a huge number. That's on top of the air pollution, 9 million per year deaths that I talked about. So it's a huge burden, huge impact on human health from climate change. We also see the economic impact of it. Because of these health impacts, you have related economic impact, which runs into about 12.5 trillion if you just look at the direct impact between now and 2050. If you look at just the impact on the health system, it's about $1 trillion. So $12.5 trillion on the GDP impact, and then $1 trillion on the health system impact. So overall, this has a huge impact on human beings. Now we have to prepare for it. So this is what we have been discussing today during the Health Day. I have participated in several discussions where the idea is to make sure we use the World Economic Forum platform, public-private partnership platform, with multi-stakeholders, with financiers, with healthcare companies, with other sectors, other industries, to bring attention to this issue, but more importantly, to bring investments that can go into the climate and health nexus, that can spur innovations for us to respond to this growing burden of disease around the world.
I think to having the budget, money and fund is one issue, but to mobilize the funding, that's another issue.
Yes.
There's always a contradiction and paradox between the countries that are affected by the climate change and where the money goes, and how to manage the whole ecosystem. How do you can say that's another challenge for the world leader and the economy and the policymaker as well?
Yeah, that's why it's important to have multi-stakeholder partnership for this. You want to have public and private partnerships from both, from global south as well as from developed countries, so that there is one decision-making coalition, so to say. We saw yesterday about $1 billion was committed to climate and health. This came from not just from the private sector and from the governments, but also from philanthropy, from non-profit organizations like Global Fund. They committed $300 million. Our partners, Wellcome Trust, Rockefeller Foundation, they committed $100 million each. So we want to make sure that there is a commitment from both sides, and it goes to the places, to low and middle income countries, especially in Africa, in Southeast Asia, some parts of Latin America where there is a real need. So we want to make sure that the money goes to the place, where there is a real need.
We just like 3 years after pandemic, and I read one of the article that you mentioned that just the beginning for another challenges in the healthcare, and then it will be worse by the climate change as well. Can you mention and how we can predict the future and the fear that we should taking off for the healthcare?
Yeah, so there's a lot of learnings from COVID-19, as you mentioned. I mean, COVID-19 highlighted the visibility for health and healthcare, the importance of health and healthcare. Many governments are very focused on growing their economy, rightly so, growing jobs, emphasis on infrastructure and all that. But COVID-19 showed us we were locked in our homes. None of that matters if we are not alive, if we are not doing well. So health is extremely important. We see the focus now in this area. I think as we move ahead, the one learning from COVID-19 is that we must prepare before the full impact of climate change hits us. It's already here, it's already impacting us, but there will be much more in the future. How do we prepare the health system? How do we make sure that we have the right infrastructure, we have the workforce to respond to climate change impact? As I said, the extreme weather events are causing havoc in many countries, especially low and middle income countries. From mental health to respiratory and cardiovascular, cancer and other things. How do we make sure that the health systems are prepared to respond to that? So World Economic Forum is working with many of our partners, London School of Economics, AstraZeneca, Philips and others, to look at the overall health system around the world. Actually, we have done research in 30 countries. Most of them are low and middle income countries, to look at their health system, to see how resilient they are, to see how sustainable they are. And then we are making policy roadmap for the governments, working with those governments to come up with a policy roadmap so that they are more resilient, they are more sustainable in future and can respond to the climate change.
How we define the sustainable healthcare in terms of carbon emission? Because from the products and
Yes. I think healthcare industry.
It's quite irony and contrary.
That's right. It's responsible for about 5 to 6% of carbon emission, greenhouse gas emission, which is a lot. If you look at the overall, if healthcare was a country, it will be one of the top 10 biggest polluters. So it is definitely a really important point, and we want to make sure that the industry does its part in becoming carbon neutral. So we are working with our partners to see if they sign our net zero pledge, and then they start to work on this. And many of the partners, whether it's manufacturers or it's our hospitals, they are working with us in that area, to make use of much more energy efficient technologies, use digital technologies as much as possible, make use of, more reusable, less plastic type of material in their systems.
Perhaps what we can achieve for the end of the COP28, what is the resolution, what the point or facts that you can take it from COP28 later?
Yes, I mean, my hope is that there will be much higher visibility for the climate impact on health. There will be more commitments, there will be more investments coming to work in this area to look at the impact of climate change on health. And then we can mobilize the global community to prepare the health system to respond to the growing burden of disease areas. So I'm hoping this is a great start here, but we take it to Davos in January. We have a bigger discussion there, and then we move forward in future for a better response.
Perhaps our team at Astro AWANI, Haris, Najib, Olinda, or Ash will meet you at Davos later next month. Sekian saja perbincangan saya hari ini di COP28. Kita terus saja bersama rakan tugas di studio.